What's up guys, welcome to another week's episode of GetPsyched. Now this week we're going to be taking a look at understanding post-traumatic stress disorder or PTSD, and we're going to be taking a little bit of a look at how to actually treat PTSD as well. Now we probably all have our own kind of conceptions as to what PTSD is. It's one of those mental health disorders that is kind of using common society language. We understand it a little bit. We think we understand where it's come from or how people develop PTSD. But what is the truth about PTSD and how do people actually develop post-traumatic stress disorder? Well, in truth, and again, this kind of goes to societal norms or societal expectations, often we associate PTSD with things like war, or we think that war veterans are the people that experience PTSD, and that actually makes a lot of sense because in truth, a lot of veterans do experience PTSD. A very high percentage of people returning from war experience PTSD. Some of the situations in which they're involved in, some of the things that they experience and witness can be hugely traumatic, and that can lead to post-traumatic stress disorder. So things like war are very applicable, very connected to people experiencing PTSD. But there are so many other ways in which people can develop PTSD. You don't have to be part of the army or the navy or the RAF or in any kind of war in order for you to experience PTSD. You can experience it from a number of different ways. Yes, war is one. You can experience it from things like childbirth or just general traumatic events that have happened in your life, things like car crashes or natural disasters, even things like bullying from childhood. People can develop levels of PTSD off the back of that. The thing to understand about PTSD in particular is that some of these symptoms, the symptoms of PTSD that we'll look into, are not necessarily associated to the experience of the trauma. Now, what I mean by that is that when somebody experiences a traumatic event, of course these things are stressful. Of course these things are going to have implications on our mental health, but not everybody experiences PTSD. PTSD is when we associate some of those symptoms, or we experience some of those symptoms rather, and associate the experiences to the traumas that we've had when the trauma isn't ongoing. So for example, if we use a societal norm expectation of PTSD, somebody that's come back from war, somebody who's a war veteran and experiencing PTSD, they may experience some of the symptoms and some of the things that they experience from war when they get home, even though the war isn't ongoing. That is what PTSD is. It's when we have those symptoms when the trauma itself isn't in the present moment for us. The thing to also understand about PTSD is that it's actually not necessarily to do with the severity of the experience. I think often what we associate with PTSD is that, it must have to be a really traumatic event in order for us to experience a level of PTSD. Now, of course, if the event is very traumatic, we are perhaps more likely to experience PTSD, but it doesn't always have to be about severity of the experience. It's down to the individual, their ability to process the experience, and also the history of the experience that they've had. If it's a repeated trauma, and we'll go into kind of complex PTSD in a little bit, if it's a repeated trauma, the severity of one incident doesn't necessarily have to be massive. That one incident can be enough to cause PTSD because that person has been through that trauma so many different times. Also, if the person doesn't process that trauma, so for example, if they don't talk to someone about it, or they don't seek help, or they don't allow themselves to experience the emotions of what it was like going through that trauma, that person can later develop PTSD. Now, as I said earlier as well, not everybody who experiences a trauma will, as a result, experience PTSD. So what actually causes post-traumatic stress disorder? Why do some people experience PTSD when others don't, when they maybe even experience the same trauma? Well, actually, it's got, again, down to the individual. We always talk about the subjectivity of the individual here in GetPsyched, and that's really important when it comes to PTSD. But there's also something to do about the trauma itself. The thing about the trauma, often when it's unexpected and it's prolonged. So we all have gone through traumatic events. Maybe it's the death of an elderly family member. Those things can be hugely traumatic, but in many cases they can be expected. However, if we experience the death of a family member that has not been expected and kind of comes out of nowhere, that can often lead to us experiencing more severe PTSD down the road. The other thing to do with this as well is the prolonged nature of some of the traumas that we experience. And I talked to you a little bit about repeated traumas that people have experienced can lead to PTSD, or more likely is lead to PTSD. The prolonged nature of some of the traumas that we go through has a real direct correlation to somebody experiencing post-traumatic stress disorder. And we'll talk a little bit more about that when we look at complex PTSD. There are also other associated factors to people experiencing PTSD. If a trauma involves multiple deaths, or if it involves children, or if it involves being trapped, in particular when there's no escape, or when we experience something where we can't escape from it and it's a huge trauma. That in itself can lead to post-traumatic stress disorder. Again, we'll look at that when we look at complex trauma. Now, there are a number of different symptoms that are included with post-traumatic stress disorder. Things like anxiety, even complex or heightened major depression can be a severe symptom of post-traumatic stress disorder. Other things as well can involve like vivid memories, flashbacks, dreams that can be almost like reliving that trauma. Other symptoms as well often involve avoiding situations that maybe remind that person of that traumatic event. So they may avoid certain people or certain situations or contexts in order not to go through that trauma again, or at least experience some of the feelings of that trauma again. These symptoms usually develop within a 6-month period of experiencing that trauma, and often it's not uncommon for somebody to experience the trauma and then for months later feel okay, and then all of a sudden that PTSD can come about if it's sparked maybe by a catalyst of a certain situation that reminds them of that trauma. That's almost where those symptoms come into play. Somebody can experience more symptoms up to 6 months after that trauma. The interesting thing about post-traumatic stress disorder as well, and particularly the symptoms, is that unlike many mental health disorders, it actually doesn't really matter when that person seeks treatment. Now, of course, it matters for their well-being. The longer you live with PTSD without treatment, it's going to be harder for you, of course. But actually, treatment itself can be just as effective if somebody has just started experiencing PTSD, or if they've been experiencing PTSD up to decades without treatment. That treatment can still be very effective. So for example, if there's like an elderly war veteran who's never talked about their experiences of war, but yet has experienced symptomologies of PTSD for decades, treatment can be very, very effective. If somebody has been in a horrific road accident and there's been multiple deaths, for example, that trauma can be severe, and if they experience PTSD very immediately after that, therapy can be just as effective. So actually, therapeutic interventions at any point in a person's life who's been experiencing PTSD, that individual will often experience benefits as a result. So one of the other things I wanted to look at when we were talking about post-traumatic stress disorder was complex PTSD. Now, complex PTSD, the symptomologies of that, or the experiences of complex PTSD compared to PTSD itself, can be very, very similar. But the thing with complex PTSD is when the post-traumatic stress disorder is impacting our daily lives. So for example, if we're having serious issues with our relationships, if we're losing connections with other people in society as a whole as a result of our post-traumatic stress disorder, then that could start to be labeled as complex PTSD. The individual may also experience things like emotional dysregulation, or challenges with their emotional regulation, and that's when somebody is not able to control their emotions very well, or experiences very sharp spikes in certain emotions at certain times, and great drops in their emotions at certain times. It's also there's also like a comorbidity to complex PTSD, when somebody might actually experience very, very severe depression or other kind of forms of anxiety like agoraphobia, for example, or obsessive compulsive disorder. When there's a comorbidity to the post-traumatic stress disorder, if those mental health issues have been as a result of that PTSD, then we could start to say that that individual is probably experiencing levels of complex PTSD. So what actually transitions somebody from experiencing normal or expected post-traumatic stress disorder into complex post-traumatic stress disorder? Well, actually in many ways this has to do with the prolonged nature of some of the traumatic experiences, and particularly when somebody experiences a traumatic event that they feel they cannot escape from. So that could be something like domestic abuse, it could be something like slavery, it could be something like torture. These kind of things where there's a situation where that person is unable to escape from, often that can lead to complex post-traumatic stress disorder. For example, if you're in a road accident, that's a traumatic event. There could be a real chance of you experiencing post-traumatic stress disorder, depending on how you process that experience and the severity of the experience, of course. But that's a situation that can be escaped from, so to speak. However, if you experience something that can't be, i.e. something like torture, where you're enclosed and somebody is controlling you, or domestic abuse, a domestically abusive relationship, that is more likely to lead to complex PTSD. Treatment options for post-traumatic stress disorder, there's of course antidepressant medication, SSRIs, that can be very helpful for PTSD, but actually therapy, time and time again, has been shown to be massively impactful for people experiencing post-traumatic stress disorder. And the part that therapy plays in that is not necessarily to find answers for that individual, it's for that individual to actually speak about the trauma when they're ready, and when the therapist is appropriately equipped to help them through that trauma. and actually learning to process the trauma itself, learning to understand it a little bit better and what it means for them in their daily lives can be massively impactful. So therapy is a hugely positive treatment option for post-traumatic stress disorder. Okay guys, thank you so much for watching this week's episode of GetPsyched. This week we've been taking a look at understanding PTSD and the treatment options for post-traumatic stress disorder as well. Hope you guys have enjoyed this week's video. If you have, make sure to like the video, you can comment and I'll be sure to get back to you. You can share it as well. And if you've been enjoying GetPsyched as a whole, then make sure to subscribe to us and you can hit that little bell next to the subscribe button and you'll get weekly reminders every time I upload. Thanks again so much for watching guys, and hopefully catch you next week.